90. I read these stories and I look at the reactions and response to them, and I'm astonished at how many people think that the government should do more. Should they, Daniel?
Well, I'm with you, Michelle. The fact is the government made itself ridiculous, in my view, during the pandemic, giving medical advice. I'm always happy to get medical advice, but I'd like to get it from a doctor. I wouldn't go to my local MP. I'm in the House of Lords. I'm happy to give you medical advice if you want. My medical advice to Kevin is don't go out on a day like this without socks.
Yes. You're not going to live that down, Kevin. You're not going to live it down.
But frankly, if I were Kevin, I wouldn't listen to my medical advice because I've got no medical qualifications at all. And nor is Rishi Sunak and nor have any of the people in the cabinet. Well, maybe none in the cabinet I can think of. So I would say listen to your doctor. And listen to the nurses, but don't listen to the government.
What they mean by this, when they want the government to do more, Daniel, what they're saying is stuff like, I don't know, higher sugar taxes. They will say stuff like buy one, get one free on unhealthy things.
Well, all the higher sugar taxes did was put prices up without having any effect. I went into my local supermarket, corner shop, just after the sugar tax came in, because I drink a lot of Diet Coke, which has no sugar, written in big letters around it. And he'd put the price up of the Coke, he'd put the price of the ordinary Coke up by 50p, and he'd also put the price of my Diet Coke up by 50p. And I said, why you put it up by 50p? He said, sugar tax. I said, look, it says no sugar. Just shrugged his shoulders. Well, I mean, just put the prices up. There should have been an incentive for me to buy that, should get rewarded for buying the Diet Coke. Not a chance. These things don't work the way people intend. You don't notice it. They don't have any great effect. The one that probably has worked a bit is heavy taxes on cigarettes. That, I think, has contributed to people smoking less. But then I think the government's entitled to tax luxuries. They always have tax luxuries for hundreds of years. Because people accept that with luxuries like perfume and scotch and things like that, people should be paying that bit extra on it, and that's a fair tax. But I think when it starts coming to sort of, ordinary food and trying to nudge people hither and yon with taxes is just preposterous.
Kevin?
Really. Well, Kevin loves taxes.
I don't... I like what taxes do to make this country a decent place to be proud of living in. But your old boss, Daniel, and our erstwhile Prime Minister, Michelle, who I think on occasion you do admire and lament the current passing of, Boris.
I do sometimes.
Yeah. One of the things that I was impressed with him that he did, the few things was, he announced a crackdown on the advertising of junk food. He announced a crackdown on buy one, bog off deals, buy one, get one free of junk food, right? Because he understood that these things can have an impact on diabetes in our country. And it's very misleading, again, and a bit mischievous when Daniel talks about, don't take advice from MPs or peers. When the government takes decisions on health policy, it's politicians fronting it up with behind them an army of experts, right? Now, so... hang on.
Like the people who put us into lockdown.
Well, please not today. Please, let's not go there.
Give him a night off bashing
please,
him up over the old lockdown thing.
So we should be really worried by the prevalence and growth of diabetes in our country. And the government, not only should it go back to the things that Boris did a U-turn on that I've just mentioned, but also let's give free school meals all the time to kids at the bottom of the socioeconomic spectrum, because school meals can be nutritious and give them guarantees of nutrition and healthy diets when often they don't get it for other circumstances. Governments can intervene in health and public policy, and so they should.
Yeah.
Sorry, feeding children is a great thing to do, but it is not part of health policy. If you're going to say my dinner is health policy, I'm going out to dinner after this, and that's a part of health policy. No, it isn't. Everyone has to eat.
No, but you're not a poor youngster, though, are you? That's what Kevin's point is. If you've got some poor children whose families can't afford or choose not to spend their money on, as often is the case, healthy food for their children, then should the state step in and help them? I would say, actually, yes, it should.